Hi, welcome. Congratulations to you and your family. Welcome to the Birthing Center at Central Maine Medical Center. We are on the main part of the hospital, which is the memorial wing on the 3rd floor. And our unit is locked, so when you come up to us, we do ask that you pick up the phone and just ask to be let in, say who you are or who you're here to visit, and we'll let you in. It's as simple as this. Hi, can you let me into the unit? Thank you. So normally you would be introducing yourself or letting the staff know why you're here, because we are a locked unit for infant security and for the security of our moms. But let me tell you more about it in one of our rooms. So we'll start in here. This is one of our triage rooms. So if you're not sure if you're in labor, if at any time you're concerned about you or the baby, we are here 24 hours a day, 7 days a week. So if you have a concern, we want you to come in. And so this is one of our triage rooms. This is a monitor that will place you on and see how the baby's doing, see what's going on. And then if you stay, we'll move to another part of the hospital, if you're what I call a keeper. Prior to that, let me back up a little bit and talk about if you're coming in, what entrance do you come in? Where do you go? So if it's between the hours of 7 p.m. and 7 a.m., we want you to come through the emergency department. Also, if anything imminent is occurring, that is the fastest way up to us. If it's just normal, you're coming up because you have questions or basic concerns, you can certainly come in through the 60 High Street entrance. At both entrances, you will go through the COVID screening process, which is fairly brief and streamlined. And then they get you up to us as soon as possible. When you're coming up to our unit, if you're not escorted by a staff member, then we will have you pick up the phone as I demonstrated and just say who you are, what you're here for, and we'll have you come in, a nurse will greet you and go from there. If you are coming from the emergency department, we will meet you down there, or a staff member from the emergency department will come up and bring you up to us. Certainly, throughout your course of your labor, if you're hoping to use hydrotherapy and use the tub, we encourage you to do so. We do have a birthing tub suite where you would have your regular labor room, but then the nurse would get this ready for you. She would test the temperature. You and your support person could come into the tub. It is a great way to help relax with your partner in labor and help with the discomforts of labor. When you're in labor, if you want to be up walking, you are welcome to. You can use these side rails for support. I will show you down at this end of the hallway is our operating room for the C-sections. We like you to know it's right here on the unit, but we do see it for what it is, which is major abdominal surgery. There are sometimes circumstances beyond anyone's control where you do need to have a C-section, but we want you to know that even in those cases, we keep it as family-centered as possible. So this is one of our birthing rooms. So if you are a keeper and you're here to have your baby, this is where you'll be having your labor, and your support person will be in here with you. These labor beds are excellent in that they move into all different positions. We have labor bars to help with the pushing, to encourage more upright positions. We have birthing balls. You don't have to worry about bringing this into the hospital with you, and your nurse can help you in supporting you with the birthing ball. We have a birthing stool, so if you were hoping to utilize that during the pushing stage. Our monitors, so this is the standard monitor, and when you first come into our unit, we will put you on the monitor just to see how you and baby are doing. But then from there you can be off the monitor. We can check the baby's heartbeat intermittently as they do over in the office with a handheld Doppler, or we even have the wireless system. So you would have the bands on your belly, but you could be up and moving, getting into the shower, getting into the birthing tub. All of our birthing rooms have a bathroom with a shower, and then as I described earlier, the birthing tub suite also, if you wanted to utilize that for hydrotherapy to support during labor. So as soon as baby is born, we encourage skin to skin, and the benefits of skin to skin, there are so many. Not only is it best practice and it's evidence-based and it's best for bonding, but we know that it helps regulate baby's temperature, their blood sugar level, mom's heart rate, baby's respiratory rate. It helps with the breastfeeding, and there are so many benefits to skin, not only right after baby is born, but throughout your stay, when you go home. It's a wonderful way to console your little one. It helps encourage good latch and nursing. So when you're nursing your newborn, it is so important to make sure you get a good latch and your nurses are helping with positioning of your newborn. So breastfeeding is a natural process, but it is a learning process for mom and baby, and each baby is different, and so it's so important to make sure that latch is good, not only to help prevent mom from breaking down and her from becoming more tender, but also to ensure that your baby is able to transfer the milk. So have your nurses help you in that beginning time. That's what we're here for. That's what our lactation consultants are here for, to help you, your little one, and your family. So it's also important for all families to know that skin to skin, it's wonderful for mom and baby, but also her support person, her partner. That bonding is huge, and the health benefits, the soothing techniques, it is just such a wonderful method of calming your newborn and welcoming them into the world and continuing in your soothing techniques of your little person. So this is one of our postpartum rooms, and so we know that with a newborn you don't get much rest, but the rest you do get, we want you to be as comfortable as possible. So we'll often move you from the labor room after you've delivered, and there's a regular hospital bed for mom, which is more comfortable than the labor bed. And so this is a sofa for the support person. That folds into a bed, and it's certainly more comfortable. And then we have the bassinet for your newborn that is stocked with diapers, wipes, the onesie shirts that have built-in mittens, the sleep sacks we provide for you while you're here, and then we give you a newborn sleep sack to go home with. We are recognized as a national certified silver sleep leader, and what that means is we're continuously educating families on the best prevention for SIDS. One other aspect that sets us apart from other local area hospitals is we have a hospitalist program here, and what that means is we have a pediatrician here in the hospital 24 hours a day, 7 days a week. The hospitalist program I think of very similar to insurance. You always hope that there's not an emergency, but we recognize that things change rapidly, and so if your newborn did need that extra attention, they are here within seconds, either at the delivery or during your stay. They're also rounding each day, making a plan with you and your family for the follow-up piece with whichever pediatrician practice you choose, and working toward a discharge plan with you. So if your little one does need some extra assistance, thankfully most newborns are very resilient and do wonderful, but if your newborn is born early and preterm, or needs help with their blood sugars and or assistance with their respiratory effort, we do have a special care nursery right here in the hospital, right on our unit. And that is a wonderful place where mom and support person can visit their little one, be in there for nursing or feeding times, and in bonding while your newborn is receiving 24-hour nursing care, being monitored more closely. And then our goal is to have your little one come back to rooming in with you as soon as they are stable and possible. So rooming in has so many benefits that we want you to be aware of, not only for the bonding, which is very important, but so you're getting to learn your newborn's cues. Feeding cues are so important. Getting to learn those early, so you're breastfeeding or feeding your little one when they're first showing signs of hunger. Also, you're learning you're a little person, each one is so unique, and the nurses are helping guide you if you have questions. We know that moms and newborns actually sleep better when they're closer together, and that's the same for family too. Close by, learning your little person, learning what techniques work for your little newborn, and going over any questions that you have at any time, day or night. Another thing I like families to know about is the infant security here on our unit. So as you saw, it's a locked unit for infant security, but also as soon as your little one's born, we footprint the baby and fingerprint mom, and that becomes a permanent part of baby's medical record, matching mom and baby together. Later on, we do cutesy pie footprints for you to take home on a memento birth certificate or in a baby book or a decorative piece of paper, whatever your preference is. But that first set right there are for baby's medical record. And then at that same time, we have a unique set of bands. They're called Hollister bands, and they have matching numbers. And so mom gets a band, her support person gets a band, and baby gets 2 bands, one on their ankle and one on their wrist, because they are little Houdinis. Think about where they're meant to fit through. And all infants lose a little bit of weight after delivery. So we always tell parents, you know, if a band comes loose to let us know. But the baby is staying in the room with you at all times. The only time they leave your side is for the circumcision or the hearing screen potentially. In that case, the staff member stays with your little one, and they'll bring your newborn right back into your room. They're checking the bands to make sure your baby's bands and your bands match. We've never had a problem, but we like keeping it that way. Also is the HUGS system. So I affectionately call the HUGS system the baby LoJack system. So there's a little anklet that goes on your baby's ankle, and it is a very sensitive system. So if anybody were to try and manually tamper with it or cut it off, it's already a locked unit, but then the entire wing of this hospital locks down. It is secure in the sense that if anybody goes too close to a door with it, then it also causes that same thing. And even if it loses contact with your little one's skin, it sets off an alarm system for your nurse to come in and check. So most families also have the question, well, how long is my stay? And we really talk about it from delivery. So for a normal vaginal delivery, it's usually about a 2-night stay. And for a C-section, it's usually about a 3-night stay. But each day, the midwife or OB is meeting with mom, seeing how her recovery is going. The pediatrician is seeing your baby, going over any questions or concerns that you have, and working on a plan together with you to support discharge. During that time, we have the nurses available helping you with any questions you have about your baby. Also, we have our lactation consultants who are supporting you the entire time, encouraging skin to skin, breastfeeding if that's something you choose, and going over any concerns, any questions that you have. Another piece of our baby-friendly initiative that we want all moms to be aware of is not only are we a donor milk depot, so if you are hoping to donate your breast milk, you go through the New England Donor Milk Bank for pre-approval, and then you can bring your breast milk here. One of the lactation consultants would meet you outside for that. But we also, if you're here and your little one needs what we call a bridge and you were hoping to provide breast milk only, of course we support moms. We have breast pumps here. We have ways to show you how to express your own breast milk, which is best. But sometimes, you know, that there are times when there is more of a need for your little one, and in those cases we do have donor milk, and just similar to blood, when someone needs or receives blood, it is tested thoroughly, it is processed, and it is safe, and we do provide informed consent for families if that is something they wish to provide for their infant if the need arises. We do have a policy in place to best protect our moms and our families, and we are having it that the support person that comes with mom, they do need to stay for the duration of the time that mom and baby are here. Now, if someone needs to leave, that's perfectly okay. They just can't come and go. So we are asking not only our moms to have their bags packed, but our support people to be prepared to stay a couple of nights. And so things to keep in mind to bring are if you have any medications that you personally need to take. Tobacco replacement sometimes can be a concern. That is unfortunately something we can provide for our moms here, but we can't provide for a support person. So if that is a concern for you, that's something to address with your provider ahead of time. Another question we often get up here on the unit is, do you have midwives? And the answer to that is yes, we do. We have certified nurse midwives who are available to you over in the OB office, along with the OBs. So an OB is a doctor who is specialized in obstetrics, who can support you during your labor here, but also the midwives who are very knowledgeable in labor and birthing and pregnancy that can support you. So we have both available to you at all times. So we know that safe sleep is crucial for your little one, and so not only are we doing education about ways to reduce your baby's risk of SIDS, but we want you to know that there are resources available if your family finds that you're concerned that you may not have a bassinet available to you, or a crib, or a pack and play, or a safe space for your little one to sleep. We want you talking with your OB provider or your midwife prior to coming in, well ahead of delivery, so we can arrange the resources so that you are able to take a crib at home with you. Again, this is a conversation that you want to be having with your midwife or OB well ahead if that is a concern for you or your family, so we can make sure those resources are in place before you're going home.